Can you get the mask that was laying on my desk? All right. It is 4 o'clock or a little after 4 o'clock on a Friday. As we're going to talk about today, we are continuing to see an escalation of COVID-19 cases, so it's very important that we convey information to you and talk about why it's so important that we follow the rules and restrictions that are out there, including the new requirement to wear a face covering starting at 5 o'clock today. Let's start, though, the way we always start, given that there's certainly anxiety and maybe resurfaced anxiety, and we are all wanting to make sure we protect one another, that we remember that we will get through this, and we will get through this together. I know we're going to get through this because we're going to make sure that we wear these, which are masks. How important is a mask? Today, this one was delivered to me. It is a hashtag Team Lane mask that is being worn by all of the Frankfort Fire Department. It's being worn in honor of Lane Kyle, who is 13 years old. He was recently diagnosed with a rare form of leukemia. Lane's dad is Josh Kyle, a captain at the Frankfort Fire Department. He's battling an infection right now, and the mask is important to people and children like Lane. If a mask is something that bothers you and you don't want to wear it for me, that's okay. Wear it for Lane and every other child or adult that is out there that is suffering, that already has conditions, and if they catch COVID from you or you convey it to somebody else who then conveys it to them, they might not make it. So to Lane, to his whole family, I'm proud of that requirement we put into place. I'm happy that it's going to help protect you, and I believe everybody around you is going to help protect you too. We are all rooting for you. I want to start today with a little bit of good news, some grants to local communities. I then want to go over the number that will show up on people's phone if unemployment is calling them, because we got about 50% of people that aren't picking up. Then we're going to go directly into the COVID numbers and reports. Then we're going to talk about testing, specifically talk about numbers of cases we're now seeing at daycares, which are increasing, and then wrap up by talking about prisons and steps we are taking to address outbreaks there. Let's start with the good news. This week we are announcing grants to 2 local communities. The Kentucky Infrastructure Authority, which offers loan and grant assistance to local communities for water and wastewater projects and is administratively attached to DLG, held their monthly meeting. They approved 2 loans totaling more than $3 million to the cities of Bedford and Pineville. The city of Bedford was approved for $909,500 loan for the Bedford Wastewater System Improvement Project. It's going to replace 3 outdated wastewater pump stations, and it's part of our commitment to make sure that everybody in Kentucky can get clean water, and part of that is that wastewater system. The improvements are going to extend the usable life of the stations, prevent system overflows, and provide uninterrupted service to 320 customers, including the Trimble County High School and Elementary School. Pretty important project when it's servicing our children. Second, the city of Pineville was approved for a nearly $2.5 million loan for the Virginia Avenue Courthouse Square Utility Replacement Project. The city is going to use the funding to separate existing storm and sanitary sewer systems in the area around the courthouse. It's going to result in new gravity sewer lines and storm sewers and inlets, new curb and gutters, and replace existing sidewalks. It's going to serve 802 customers in Pineville. I'm excited about these improvements. We're going to continue to talk about good things that are going on in Kentucky, how we're going to work to lift up every single community. And while we are dealing with a crisis now, and we are, it doesn't mean that we stop our previous day job of trying to move this state forward and be ready for that moment that this is over, to make sure we are ahead of other states in our economic development, in our health care system, in everything we need to do to be competitive and to be a leader and not a follower, especially when we are done with this. Second, yesterday I reported that this week we have more than tripled our workforce to deal with unemployment claims. As many of you know, or as I've talked about, we had a real challenge here. In 2017, the previous governor cut half our unemployment offices. Several legislators tried to file bills to prevent that from happening, but it didn't even receive a hearing in our General Assembly during that session. Moreover, 95 individuals were moved out of processing claims. That, along with a budget that was cut in half and a system that was put in 2000, led to the situation we're seeing now. But to be fair, it was a global health pandemic that pushed claims to a higher level than any that we've ever seen. So we've taken action. We increased our workforce from 40 claims processors to 100 at the state. We have reorganized that office to put it over in the Labor Cabinet, and the head of that cabinet is currently running UI himself. We now have EY, a national consulting firm, one of the big four, one of the most sophisticated companies in the world, helping us. They have 220 people processing claims on top of ours. So we've gone from 40 to 320, and we hope to have 80 more at the beginning of next week. So we got a lot of people out there calling, especially our March and April folks, that haven't gotten the help they need. That's a really good thing. But a tough thing is only half of the calls that are being made are being answered. So we need you to answer the calls so we can help. The number that will pop up on your phone, and this isn't a number that you can call to get somebody, it's really important to tell you that. But this is the number that's going to appear on your phone when they're calling you, 502-333-9130. If that pops up on your phone, the unemployment office or EY is trying to get a hold of you and is trying to help you out. So please, 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 carry your phone, answer the call. We want to get your claim resolved. We want to get caught up. We want to make sure that we resolve what has been an underperformance by us, that we've had people working hard. This is something we need to get fixed, and I'm trying to do everything I can to get it fixed. The thing I need from you, answer the phone. Also, remember, unemployment face-to-face across the state was just up. Next week it's Covington, it's Prestonsburg, and Frankfort, of course, is working 5 days a week right now. All right. So yesterday we talked about how we have been seeing escalating COVID numbers, and we continue to see explosions of this virus in other states. This could easily be us if we don't take action, or if people frustrate our attempts to take action. I want you to think about the fact that in Kentucky, we have had about 18,000 total cases. In Texas, they had about 60% of that just yesterday, with 11,612 new cases, and 16% of everybody tested came back positive. Arizona is even worse than that. Remember, 1.5 times larger than us. We're going to announce today we have over 400 COVID cases today. They have 4,000. And more than a quarter of people that are being tested are testing positive. You want to know why everybody wearing masks and the requirement is so important? Is that we could be Arizona. 10 times worse than we have it right now. ICU beds running out, hospital beds running out, doctors having to choose who gets help and who doesn't. I believe that the mayor of Phoenix was on cable news today saying a morgue truck has even been ordered by one of the hospital systems. We can't allow that to happen to us. I'm not going to allow that to happen to us. And if you want to be what Kentucky has been, a model of success, and not where Arizona is right now, which is a lot of people hurting. I'm not trying to compare governors. I'm not trying to compare states. I'm just trying to make sure we don't end up in the dire situation that the citizens of that state are facing, that I need you to wear a mask. Wear it for Lane. Wear it for your own family. Remember, Scientists and health experts now agree that this doesn't just keep you from spreading it to other people, it actually helps you not get the virus yourself. So do it for your kids so you don't bring the virus home to them, or do it for your parents. If they're the age of my parents, and my parents are going to be mad after I say this, it means they're in an area where they are more susceptible to the harm that can come with COVID. I saw a statistic earlier that just in the last 3 days, Florida has had more new cases than we have had since the beginning of this virus. Don't go to a Florida beach. If you do, you and your family right now are almost likely to get it. 20%, 1 in 5 that are being tested in Florida have it. Let's not take a 20% shot of getting COVID and spreading it through your family or bringing it home. And that's not to try to cast blame on anybody who has it. It spreads fast, and most of the time it's not anybody's fault. But it's about us doing everything we can to make sure that we are protecting the people around us. This is really alarming. That's why we're acting early. That's why we're acting fast. And that's why no matter what people try to throw out there, and I'll answer questions later, but yes, this is mandatory regardless of anything else that's out there, and we can explain why. But this is really important to do so that we don't have to order more trucks, so that we can take care of everybody. When what we saw in New York is happening in other places, it's happening right now. Let's not let it be us. So today's report is the second highest total, I believe, that we've ever had in Kentucky. And if you look back at our highest total and remove Green River, that had 300 cases that day, it would be our highest. So today we're reporting 426 new cases of COVID-19. Brings our total cases when we remove duplicates to 18,670. Of that, 17,890 are lab confirmed, and the rest are probable. So, you want to know why we got to step up our game? I think Coach Cal said that the other day. It's because COVID is stepping up its game. And more people are testing positive, and it's not just because of more tests. In fact, our positivity rate, which is based on a 7-day average, 2 weeks ago was 2.47% of people who were being tested positive. Last week, 2.87%. This week, 4.5%. That shows you what's happening, but we can address this, and we can do it now. Keep your social distance, wash your hands, follow the rules and restrictions at work and at home. Don't leave the home if you don't have to. Reduce your contacts and wear the mask. That's what we have got to do to defeat this virus. So today's news also has some other tough parts on it. We got a lot of kids under 5 in this report that have COVID. They include a 3-month-old girl from Casey County, a 1-month-old girl from Hardin County, a 9-month-old boy from Hardin County, a 3-year-old from Henderson, a 2-month-old from Hopkins County, a 5-year-old, a 2-year-old, a 1-year-old, a 4-year-old, a 4-month-old from Laurel County, a 3-year-old from Madison County, a 1-year-old from Warren County, and a 3-year-old from Warren County. Folks, I have kids. They're older than this now, but they would get a fever, and my heart would stop beating. I mean, I would stop breathing when they were hurting, and this happens to our kids too. So whatever your reason is to wear a mask, that's a pretty good one. And it tells us that, again, nobody's immune to this. We've got to be really careful. Now, there's some numbers that we're not going to be able to report accurately today because we are changing our system for getting them in. Those are our hospital beds, our ICUs, and our ventilators. We've changed the system to get better, more accurate, and timely information from our hospitals. We thought the information was good, but now everybody's going to be able to fill out one sheet and get all the information to us. I hope by Monday, but if not, then by Tuesday, we'll have that information again. It would not be accurate if we gave it, but I will say 426 cases is not good news. 4.5% positivity rate is not good news, but we still have a lot of hospital beds. We still have a lot of ICU beds. We still have a whole lot of ventilators, and those are all good news. But let's keep it that way. Let's certainly not tempt fate. Let's do what it takes. New cases by county. I'm not going to read all the way through it. We're just going to do counties over 10. Jefferson 63, Fayette 43, Warren 26, Graves 20. 20 in a day. You look at how quickly this can arise. I think I've at least heard that there's a separate politician, not in Graves, but in another area of Western Kentucky that just said, I'm not doing it, I'm not wearing masks, nobody can make me. But almost right next door, 20 cases in a day. Let's protect people. Let's do the right thing. 16 in Hardin, 14 in Shelby, 12 in Henderson, 12 in Laurel, 11 in Boone, 10 in Davis, all over the state of Kentucky. It's happening. And the more people who wear masks, the more leaders who model wearing masks in any region of the state are going to be safer, are going to have their economy reopen and be able to stay open, are more likely to get their kids back in school, and are less likely to lose people. Those that don't follow it and don't model it, you're just risking the lives, the economy, and the schooling of the people of your region. We're also reporting 8 new deaths today. And one of the concerns for our country, for all those states we showed earlier, is the death peak follows the infection peak. Because people get it, they test positive, and if they pass away, it's sometime after that. And so, again, I had hoped that we were past having to report these every day. We had 2 days in a row where we had 0. But unless we do, again, what it takes, unless we follow those rules, I'm going to have to read a lot more of these. So our losses today include a 79-year-old woman from Warren County, an 89-year-old man from Grant County, a 78-year-old woman from Warren County, a 68-year-old man from Clay County, an 88-year-old woman from Fayette, an 81-year-old woman from Shelby, a 61-year-old man from Warren, and a 69-year-old man from Russell. And for anybody who says that this thing just comes for really old people, well, first, you ought to want to protect them too. Don't be callous. Don't suggest this should just take people. It shouldn't. Our job is to protect people. That's a duty from our faith. That's a duty in government. That's a duty as a citizen. But look at that. We've got 3 people in their 60s that are on this list today. So, again, a very serious situation. Race and ethnicity. Overall cases on ethnicity, 83.59% non-Hispanic, 16.41% Hispanic. Race, 76.2% white, 13.57% black or African American, 3.5% Asian, 5.87% multiracial. And then deaths, where I think I say it just about every day, we're seeing disproportional deaths that are the result of inequity in healthcare and many other areas. And that's what happens during a pandemic. It results in death. 95.8% non-Hispanic, 4.1% Hispanic. And then on race, 81% white, 15.25% black or African American, about 1.3% Asian, and 2% multiracial. Long-term care facilities. This is why we got to be so careful. You spread it to somebody who spreads it to somebody who spreads it to somebody who works in one of these facilities. Since yesterday, 20 additional residents have tested positive, 20 additional staff, and 2 additional deaths. They are all residents. None of them are additional staff. And that's tough. And there's nothing good about it. I do want to show you how that compares to other states. This is the cases and deaths per 100,000 residents. Let's start with the cases. This is to help James know where we're going. He's working on it. What it'll show is there it is. So Kentucky is the reddish purple, burgundy, I'm not good with colors, is the one that is not yellow or yellowish orange. And it shows that compared to most places, and especially given the health of our people, we're doing pretty well comparatively at keeping cases down, and even a little bit better than that on the death side. Unfortunately, there's no way to be at a zero here because of what COVID does. But again, I want to try to give you this in context, because the reason that we're not higher on this, and if you can show the death slide, the reason that we're not higher on that is that we've done a good job of following the rules. Now, we know we got to kick it up a notch. We've got to make sure we wear our masks along with everything else we did do. Those in long-term care are depending on it. So with our cases increasing, we need to make sure that we continue to test and to test at the levels that we have been testing to date. Let me get our overall testing numbers. We have tested 470,548 Kentuckians. Again, we're doing really well on the testing side. We just need people to continue to get tested, and we're seeing a greater appetite to be tested. So if we will put up what's next week, especially on the Kroger drive-thrus, based on our increase, and boy, hasn't Kroger been an incredible partner, and they donate their services. Gravity Labs obviously sells to us, but at a deep discount, being a Kentucky company. They've decided that they'll do extra hours to get more people in next week. We had almost every one of these taken during this week, and let me tell you, these workers are phenomenal. It is hot outside. We've had a couple people pass out, and they keep showing up every day because they know how critical this is. So remember, if you're in that line, you're a little scared and you're a little anxious, those people are out there in the blazing sun because they want to take care of you, and we've even had to bring in big fans to take care of them. So I tell you what, you don't want to wear a mask for the kids that are getting COVID, or for our kiddo here in Frankfort. How about for all those healthcare heroes that still need you to wear a mask as we move forward? I also want to give some quick information on labs. So across the United States, as cases are significantly increasing, we're seeing some, especially national labs, getting back to taking 5, 6, 7 days for a turnaround. That's not acceptable. And as a state, we're not going to contract with anybody where we can't get it back in a couple of days at the most. So if you want to provide lab services in Kentucky, you're regulated. You need to go to the first link that is up there. But here's the next one. We're going to connect you as an employer, as an association, if you want to get lab services. If you want to work with them directly to get tested, if you're a healthcare group that we're not working with right now, you can go to our website and get the information you need to connect with them directly. These are groups down here that are currently registered on our website. There are at least 3 of these that have become major labs in Kentucky that are turning our tests around and turning them around pretty quickly. Without homegrown Kentucky companies rising up to help us with this, we would be in a much worse situation, and we are going to need them now more than ever as we move forward. Another topic we've recently talked about is daycare, and this came up because we had to put in some really strong regulations, and a long time ago we showed how a daycare can spread contacts between people and spread them really quickly. Because of that, we followed some really good public health guidance. We did what a lot of other states are doing, and we limited the size of classes. There's a lawsuit that was filed in a northern Kentucky court that wanted to take classes from 10 to 28, and the argument is we're not seeing cases in daycares. Well, you know what? We are seeing cases in daycares. So our Cabinet Secretary for Economic Development, Eric Freelander, is going to talk about what we are seeing right now, both in Kentucky and, just like Texas is exploding, we'll talk about what they're seeing, which could be our future if we don't do the right things.
Thank you, Governor. So we've tried to support our daycare centers. Talked about it a little earlier. We provided over $67 million to try to help keep them open. And as we've reopened, we've put some different restrictions around class size. As of today, there are over about 450 daycare centers that haven't reopened, about 80 certified child care centers that have not reopened, but the vast majority have. And what we've asked is, we've asked to limit that class size to 10. Think about it. You saw a slide earlier where we talked about how many different contacts you come in and how you multiply that contact by going and having a child in child care. When you limit that class size to 10 and you limit the staffing to that class size, you limit the potential exposure of everyone associated. So as you expand that, you multiply that by 2 and 3 times. And in Kentucky, we've already seen 13 centers that have had cases, 22 children and staff who have the COVID-19 virus. You saw Texas earlier. Yesterday, 1,700 children and staff were diagnosed with having COVID-19. That's not the model we want to follow. We want to be very careful about how we reopen because we need to protect our children and families. That's what this is about. You've heard the governor talk about it's important to wear a mask. It's important to wear a mask. If you want to keep the economy open, wear a mask. If you want to make sure that we can have sports in the fall, wear a mask. If you want to protect your loved ones and families, wear a mask. And in these child care centers, we have to be so very careful because if you're looking at positivity rates that are going up, this is the way to guarantee that that happens. So we're trying to take a measured approach. We're trying to take an approach that saves lives. That's what's most important. Some child care operators have complained that they don't feel like they can make a profit at what we've asked for them to do. But I'll tell you what, I'll put the lives of Kentucky's children and families over profit any day. And that's what we have to do. So thank you for this opportunity to say that, Governor.
All right. Speaking of people's kids, the Lieutenant Governor got some tough news today that one of her stepsons has tested positive in the last couple days. He was not staying with the Lieutenant Governor and her husband. The Lieutenant Governor and the rest of the family have tested negative. I know she'll have a statement that'll be out here soon, but our thoughts, our prayers are obviously with that stepson who I'm certainly not going to identify here today. He's a great kid, and we want to make sure that he gets better, fully asymptomatic, right now not in any danger, but again, these things can strike anywhere at any time. Let's wear masks, let's do everything we have to do so it doesn't continue to spread, to impact anybody's children whatsoever. Now we're going to get an update on prisons from J. Michael Brown.
Thank you, Governor. We have been closely monitoring what's been going on in our penal institutions, and as you know, I've been here several times to talk about Green River, which is the first one where we had what you would call an outbreak of COVID. Happy to report on Green River that of the total 418 cases that had been reported at Green River, we have 417 that have recovered, We had one inmate that actually went out to the hospital for a separate procedure, tested positive when he arrived, retested, and tested negative at the same hospital. But we are counting that in the total. Now we turn our attention to the Kentucky Correctional Institution for Women, known as Pewee Valley. Currently have 176 positive tests there. We retested the entire population. We have about 258 tests waiting to come back with those results. Of that 176, we have 5 inmates that are hospitalized right now, 2 in ICU. But again, what we are doing at KCIW is applying the lessons we learned at Green River, separating the populations, doing the testing, using all of the sanitary procedures, and including masks. And at this point, since masks has been a big subject, I'd like to shout out to our correctional industries. We have turned out from our inmates 142,000 masks to date, including 45,000 that have gone out to our prisons, so that we have been widely using the mask all across our prison populations. Thank you.
Thank you, Michael, for that update, and thank you for reminding all of us that our fellow Kentuckians that are currently incarcerated, while they may be incarcerated for doing something wrong, if they're working on creating those masks, they're doing something really, really right. Not just to protect people inside, but we have given out tens upon tens of thousands of those masks to individuals that drive up to get tested, leave with a mask that can protect them, leave with hand sanitizer, and we owe our incarcerated individuals working on those a big, big thank you. They've become a big part of this fight against COVID-19, and we appreciate it. All right, we're going to move straight into questions. We have a number of journalists that are here. I think I have 2 written questions that I can't find, but I will try to before the end. I think you started yesterday, so we'll start over here with Karen. We missed you.
Governor, the message boards today in Kentucky have been filled with people saying, several believe the numbers are up because testing is up. Can you explain how that works?
Well, if the numbers were only up because testing's up, the positivity rate would be the same, right? If right now the positivity rate, 2 weeks ago was 2-point-something%, so 2 out of 100 tests. This week it's 4-point-something, so double the number in the same number of tests, double the number of people are coming back positive. No, it's not a claim, it's not an argument, it is a fact that we are having an increase in COVID cases that is not attributable simply to more testing. I love that we're doing more testing, but we're having more people test positive.
Our viewers are letting us know that all the appointments are gone for next week's Covington in-person unemployment. Will there be days and appointments available?
So our hope is that we will move in the future to have permanent offices. We certainly want to have one in the Covington area. What we're having to do with our limited in-person staff is to move that around the state right now. But can you put back up the number? We are calling 3 times more people today than we did at this time last week, and we're going to call 4 times as many people every day next week. So if you see this number, pick it up. We'd love to see you face to face, but if we can resolve your claim on the phone, let's get it done. And our hope coming out of this, my hope, is to have regional offices now into the future, to never starve this system again, and to give people the help that they need. Let's do the back and then we'll do Joe. Yeah.
How many claims are left in March as far as the numbers?
I believe that we are, I'll get the exact number, I believe it's still in the 7,000 range. My hope is that we cut that down significantly. There are going to be some of those, though, that don't qualify under the federal requirements. There are going to be some of those that are going to require full-blown hearings because of disagreements. We know that we've done more than 90% of all the March claims, but I believe that of those 7-odd thousand, there's still a number where people accidentally checked a wrong box, that if we can get them on the phone, and they can pick up, we can get it fixed, and we can get them their unemployment. Joe?
Your mask order goes into effect at 5 p.m. today.
Yes, it
Attorney General Cameron has filed a motion in the Scott County Circuit Court with the judge who filed a restraining order yesterday. If that judge grants that order and says that the mask order is that is enjoined, what's your reaction to?
So the question is, revolves around our mandatory face covering order, which goes into effect at 5, and it does. And there being any question that the restraining order that's out there from which court? From Scott County somehow stops it. It doesn't. That applies only to executive orders, and we think it's wrong on that. But we also did an administrative reg, an emergency regulation, separate and apart, that hadn't been enjoined, includes all of it, and is in effect. So everybody needs to know it's in effect. The Attorney General didn't file a motion to stop the mask. He filed a motion for a hearing for the judge to think about whether or not it violates it. If the judge wants a hearing, we've got some questions to raise about some undisclosed information that we think should have been available to the parties to ensure that we were going to get a fair hearing. Tom?
Joe's talking about in Scott County. I understand it's now before the Court of Appeals. Are you going to seek to have it expedited to the Supreme Court? And when do you plan to seek that?
Right. So we have taken the Scott County injunction and to use a term I think everybody can understand, we have appealed it, though the process is called a writ, to the Court of Appeals because we believe that it's problematic. I think it may have been you, Joe, that talked to 2 law professors on very different backgrounds, and you don't write restraining orders like this. It's very bizarre. It's not legal. And we expect that the Court of Appeals, either in an initial motion or in a larger hearing in front of a panel, will overturn the restraining order. Now, once they make that decision, we can get that to the Supreme Court. But it's time, if we're going to get lawsuits on this stuff, that we go ahead and get it in front of the Kentucky Supreme Court and get a final ruling. Listen, I know sometimes in media reports are on drama. It's the AG versus the governor. It's not. It's the people of Kentucky versus the coronavirus. Anybody who makes it harder to defeat the coronavirus, that costs lives, that results in people going through significant sickness. I just want to do the right thing to help protect our people, and I'll go through whatever courts we have to get there. Alex?
You talked about how people who kind of willfully defy the mandate because of the fact about 20 minutes will receive some sort of warning and then potentially a fine, but it's going to be enforced in part by public health departments and maybe law enforcement, I don't know. What is being communicated to public health departments about how to enforce it, and what do you do about just like individuals in groups, not inside business, who are willfully defying? Are they stopped by police, for example, if they put a mask on?
So the question is on enforcement of the mask requirement. And every order that we put out, there's always been questions about how you enforce it. First, we shouldn't have to. I know we will. But with an exploding number of COVID cases, all these kids under 5, many of them under 1 year old, getting it, with people's lives on the line, with $10 billion of economic activity that we will lose if we don't do it, with us wanting to get our kids back in school, and a lot of that depends on whether we wear masks and stop the escalation, we shouldn't have to put penalties out there. But unfortunately, in some instances, you have to. So the number one way that this is going to be enforced is that a business that is in the order can't serve someone that's not wearing one. That includes every grocery store. Well, it's hard to eat without going to the grocery, and so just wear a mask. That'll be a good method of enforcement. Retail as well. And I will tell you that those businesses and through their national and others, have asked us for this, have said it's important to protect everyone, and they know that we can't keep our economy open if we don't do it. On the enforcement side and other areas, we had a call today between our State Department of Public Health and our local health departments going through lots of questions. Our public health departments are warriors, our local health departments. You know, some of them are going to have to do this even when their county judge is grumbling about it and is not wanting to do it. And let's hope there aren't any of those out there, because that county would be less safe because of it. But I know that they are up to the task. We answered a full series of questions for them. A lot of what we're going to need them to do is go to the higher trafficked areas and make sure in places where people have to wear them that they are wearing them. Now, my hope is that law enforcement does the same thing they always do. They protect us. And whatever degree that is, okay. But at least if there's a whole group of people, you know, outside even, because you still have to be 6 feet apart, that aren't wearing masks, I would hope any law enforcement officer would say, I'm kind of worried you're spreading COVID. Would you please put on your mask? You know, enforcement's not going to be easy, but it's important that there are enforcement mechanisms. Thanks for being patient.
Attorney General Cameron said if you had just come to him first and come to that side of the assembly first, ROs, motions, suits could have been avoided. I can see by your face you don't necessarily buy that.
No. Can you put up the Mississippi legislators? We got almost half our General Assembly that when they meet refuse to wear masks. And the claim is if I'd only come to them and talked about a mask requirement, that things would be okay. This is what happens when you don't take it seriously. There are 26 legislators in Mississippi, 26 that have been diagnosed with COVID, and there will be more than that. Again, this isn't supposed to be about D versus R or the governor versus the legislative branch. It's just about doing the right thing for the people of Kentucky.
People think individuals can be fined.
Individuals can be fined. It'll be. Well, I think that the easiest way of enforcement is just to give our businesses the tools to deny service, which they now have. And I talked to a group of bars today, trying to work on bar owners and very responsible ones, trying to work on additional guidelines that can help us and make sure that we can keep things open that other people can't. And one of the first things they said is, thank you. This lets us just tell people what it is and how to do it. And it's going to go a long way. But if you have individuals that are chronically refusing to do it and walking into places of business that are trying to stop them, you can't blame the business for that. Now, please don't check them out. Please don't complete the purchase. But at that point, there's got to be an enforcement mechanism with an individual. And if you are intentionally walking around a grocery store symptomatic, coughing on everything, I hope everybody would say, Governor, make sure you do something to make them wear a mask. It can be done through the administrative regulation that we filed.
I'm seeing an escalation of cases, but for parents who have to have appointments for their child to have a wellness check, you want to address that?
Yes. Now, we have an increase in cases, but it's important to know that that shouldn't keep you from taking a child to a medical facility or to a doctor for their appointments. We've actually missed too many of these. We had to, for a short period of time, close down just about everything in the medical field except COVID. But now our kids and everybody else are behind on things that they need to get done regularly. Our hospitals are doing an amazing job at trying to control and prevent any outbreak at their facilities. The one thing I would like to see, though, is ensuring that their employees aren't going to a beach somewhere, because right now that's bringing so many things back. But yes, take your kids to their wellness check. It's gonna be safe. Your kids are more likely to be harmed by not discovering something else that could be serious than by this. This is real serious, but so is the rest of the health of your children. My daughter had a tooth issue. We took her in yesterday, and in a dentist's office, you got to be really careful. But they were following the rules, they were doing a good job, and our medical providers all across the board have just been all-stars, not just at treating, but at reopening.
It's scheduled to have a game, and there's expected to be 5,000 people in the audience. Do you have any problem with that now, considering the rise in cases, or is that still okay based on your guidelines?
So I believe that the professional soccer game, provided that the teams move forward with it, because I know there have been some instances where there's been decisions not to, can be safe if, again, people are really spread out and everybody wears a mask. And it's going to be really hard in the area to not come into contact with someone within 6 feet at some point, and you need to have that mask on you, and you need to pull it up every single time. I actually believe that if we can follow the mask mandate, we can do a lot of things we're not doing right now. What we really need is about 80% of Kentuckians following this, and our old normal will become pretty close to possible. I know that's a heavy lift, but we need to see people doing it and doing it this weekend, and if they're not doing it, then we'll have to reassess from there. Tom.
Governor is kind of, well, again, along with Joe's question here, we've got, I'm sorry, but we've got at least some sports leagues canceling their fall sports. Do you think that we can have high school football yet this fall?
I believe sports in Kentucky are going to be dependent on our ability to stop the current escalation of cases that we're seeing. So if you believe that you shouldn't have to wear a mask and you can walk around, and if you're infected, it's everybody else's fault for coming into contact with you, you're destroying sports. If you're walking around refusing to wear a mask and potentially spreading this virus, you're threatening the economy. If you're walking around refusing to wear a mask, listen, you may have this. You're putting people's lives in danger, and you're making it harder to reopen schools. But throw sports in there too, because it's serious and significant. And we are seeing a number of high school programs shut down right now when someone tests positive. Now, the fact that they are getting tested, the fact that we're learning about those, and then the shutdown occurs is a positive thing from a procedural standpoint, because if and when we're able to move forward with sports, that's going to happen. So my hope is that we will also consider testing protocols. Again, we oftentimes drug test, even our high schoolers in certain sports. COVID test, if it keeps it safe, I think something they ought to consider as a requirement as well. All right, Alex.
Other states have kind of not banned, but kind of singled out their residents traveling to and from other states that are known hotspots. They've said, okay, we know people are going to go on vacation here, but if you do, we really want you to quarantine for 14 days. And then your office basically did that with Myrtle Beach. Do you have plans? You mentioned Florida Beach just a couple of times. Do you have plans to do that with other states?
We will look as we move forward about whether we ask people to quarantine if they travel certain places. Look at Florida. My goodness, if you're going to a beach in Florida right now, like I said this earlier, but I'll repeat myself, you're putting yourself at a huge risk. 1 in every 5 people being tested in Florida is testing positive. And then you bring it back to your community, and we have dozens of examples of it being spread from that right now. Admittedly, I've been real positive on most of our healthcare systems. One of them, when we talked about how dangerous Myrtle Beach was, said, well, we're not going to follow the advice for our hospital system. I get that people are short-staffed, but we need support in those types of decisions to basically say, don't go. Just don't go. And so, yes, we will look at that moving forward. We want to make sure we do it the right way. I'm not sure if it'll be cities and counties we look at or other states, but certainly we can't have a whole bunch of Kentuckians continuing to go to Florida or Texas if we go there, or Arizona. All right, everybody. We're back in an incredibly important crunch time. We've been here before. We had cases doubling every 3, 4, 5 days in Kentucky at a time when you saw other states get overwhelmed. We rose to the challenge. We did what was required. We flattened, we crushed that curve, but the game wasn't over. And while we've taken a little bit of time off, or we haven't played as hard as we should, COVID has caught up. It's time that we get our game face back on. We make sure that we and everybody around us get back to doing what's necessary. And we talked about Team Kentucky, about this taking all of us. The use of the word team isn't a mistake. What everyone does matters. If you want to beat COVID, you matter. Person next to you matters. Every single individual matters, and we are connected in a way right now that I can't ever recall us being connected. So let's come together. And if it means saving lives, saving the economy, getting kids back in school, saving sports, wear a mask. It is not that much to ask. We are not asking people to make sacrifices that those in our military make every day to protect the country. We're just asking you to put a covering over your mouth and over your nose. Let's get this done. Let's remember, regardless of all the noise of the politics out there, it's us. It is us, the people of Kentucky, against COVID-19. So let's get it done. Let's keep each other safe. Make sure you are safe this weekend. Thank you very much.